Hello everybody, my name is Brooke Johnson. I'm on the West Des Moines Girls Softball Board. I help coach in the Tiger program, but I'm also a board certified emergency medicine physician, and I want to give you some information about the AEDs that we have at our fields. So first off, on location of the AEDs here at the Tiger cage, the AED is located on the back wall in the AED machine, and at the fields, it's located at the concession stand. So the reason that this is so important that we have access to AEDs is that 15% of out-of-hospital cardiac arrests happen in public locations. And of those arrests, only 1 out of every 10 patients actually has an AED applied. But with the application of AEDs, we can nearly double the chance of survival of an out-of-hospital cardiac arrest. With all of the extra people that we bring to our parks for all of our tournaments and recreational play, this is why it's so important that you guys are aware of the AEDs and how to use them. Because just last summer, we did have a patient collapse and need the assistance of CPR. So if you ever happen to be at the fields when someone collapses in cardiac arrest, obviously the first thing we always do is call 911 and then tell someone to get the AED. Check if they're responding. Hey, are you okay? Are you okay? You check and see if they're breathing. Tilt their chin, see if they're breathing. Check their pulse. And if you don't feel that, cross your arms and start compressions. Now, unless you are CPR certified, where you are going to give rescue breaths as well, for non-trained bystander CPR, it's compression only. So cross your fingers, center of the chest in the nipple line, and push hard and fast. You keep your arms straight and push hard and fast. So whenever you get the AED machine on scene, it's already going to tell you everything to do. You're already checking your victim and starting your CPR, you're calling 911, and you're getting the AED. So as soon as this arrives on scene, it's already here. You can go ahead and turn the machine on and lift and flip it open. What you'll immediately find on the inside are the AED pads. These are very self-explanatory. They show you exactly where to stick it on the patient's bare chest, and they're already plugged in, ready to go for you. So when you turn on the machine, it's already in analyzation mode. So one thing to note about the AED pads is that the pads that come standard with any AED machine are safe to be used on kids over the age of 8. So pretty much most of the players that are playing on our fields, should any of them collapse in cardiac arrest, these AED pads can be used for them too. So when the AED turns on, it is very self-explanatory. It will tell you exactly what to do. It'll start with, hey, is the victim okay? You've called 911, you've gotten the AED. You'll be starting those chest compressions while someone is getting the AED. As soon as the AED arrives, you're putting the AED on the patient. You're analyzing the rhythm. Now during this stage, no one should be touching the patient. It's showing you that they're standing away. And if a shock is meant to be delivered, it will tell you shock is advised. You will push the button for the shock, and then it will immediately tell you to resume CPR. Now again, unless you are trained in CPR when you're giving the breaths, bystander CPR that is untrained should be compressions only. You just keep compressing until it tells you to analyze the rhythm again. So the reason we find this so important that West Des Moines Girls Softball has AEDs in public locations is that for every minute that a person who has collapsed goes without CPR or an AED, they decrease their chance of survivability by 10% every minute. This shows that when AEDs are used, they can dramatically improve survival rates. Now, obviously, we would never wish for anyone to collapse at our fields, but at West Des Moines Girls Softball, we are very thankful that we have AEDs available for public use. So thank you guys for what you do for West Des Moines Softball, and let us know if you have any questions.